welcome. My name is Jeff Ribordy. I am the Regional Medical Director for Humboldt and Del Norte counties for Partnership Health Plan of California. And I am here with Dr. Jim Killfoil, who is a pediatrician at Redwood Pediatrics in Fortuna. And Jim, why don't you tell us a little bit about yourself, your background, your site, and your staff?
Okay. So I grew up in California, San Jose, went to undergrad at Stanford, went to medical school at UCSD, then went out to Philadelphia, Children's Hospital, Philadelphia for my residency, and then came to Humboldt County right after that. So I've been in Humboldt County, Fortuna for 25 years now. For quite a while. I've got two children that were born and raised here, off to college now, a wife, and lots of animals. So that's kind of me. Like I said, I've been at Redwood Pediatrics for 25 years. Got a great staff that's there. Most people from the staff born and raised in Humboldt as well. A few transplants into the area. A lot of people with kids in the community as well. So a staff that's really invested in the community itself. That's pretty much it. We're a small clinic. We have two pediatricians. We have a pediatric nurse practitioner and a nurse practitioner who work part-time for us, 1 4 days, 1 3 days. And that's pretty much it about our clinic. So
What kind of animals do you have?
What do we not have? So we have 3 Great Danes, 4 miniature horses, an alpaca, a tarantula, an axolotl, a few other things.
So what's bigger, the Great Dane or the miniature horses?
The Danes are about as tall as the horses, but the horses outweigh them. So
Got it. Okay. Today we're here. We're talking mostly about well-child visits and why they're important and why we do them. So just kind of an open-ended general question is basically why should a parent bring their kid in for a well-child visit, and what's kind of entailed in a well-child visit for both the parent and the kid?
So I think there's actually a ton of reasons to come in for well visits. Some of the most obvious may be growth and development monitoring. It's a little bit different for the really young versus the older there. But certainly in the first 4 or 5 years, we're looking at how they're doing with the development, whether it's physical capabilities, if it's language. Later, it might be things that they're able to learn, pick up on. That's clearly important. And when we pick up on issues that aren't going as well as they are, we can do interventions that can help them out so that they go more smoothly in the future. Growth is huge. Obviously, babies go through really, really rapid growth. We need to make sure that they're doing that well. And as people get older, we're monitoring that also. So that's a huge part of what we do. Vaccines are a really important thing that we're doing. The first year and a half, especially for children, we have a large number of vaccines that we want to get in to try to protect them from some serious illnesses. As they get older, there's some boosters at like 4 to 5. There's more vaccines that we do like around 11 to 12, as well as they hit into the late teen years as well. So that's important. And I think on top of that, outside of those issues, pretty much any issue is open for people to talk to us about. We get concerns about behavior, we get concerns about eating, we get concerns about how other things are going on in the household with people. So anything's out there for people to ask us about, and we try to answer them. It's good for people to get to know us, for us to get to know them. You develop a comfort level with the person that you're seeing over and over again. So sometimes when people get older and there's tougher questions, tougher things to talk about, there's that familiarity that makes it easier to talk to people about some touchy situations. I think that's a big thing. If you're only in once in a while for being sick, you don't get that that sense of familiarity with the family and the family with you. So there's lots and lots of reasons to come in that can be beneficial for the child, for the parents, and for us in getting to know them.
All right. Yeah, it sounds like the well visits for the younger kids are much different than the well visits for an older kid. What kind of things do you do to gear the appointment and gear well visits for, pre-adolescents and adolescents?
So obviously the issues we talk about with a 2-month-old very different than a 16-year-old. There's feeding questions, there's elimination questions that you're going to get with the 2-month-old that you're not going to get typically with the 16-year-old. There's questions that are maybe more sensitive that you're asking a 16-year-old that you're not going to talk about with a 2-month-old. So the issues that we bring up that we talk about are definitely different and are based on the age and the developmental sort of accomplishments of the child that are there. And obviously the parental concerns that they have are different too. So it kind of depends on the age, the concerns that the parents, the concerns that the child as they get older have with us. And you can kind of morph that visit into anything that those people want to talk about at that point. We usually have our set questions that we want to ask people at those different ages about things, but then it kind of just follows the pathway that that they have concerns about.
Okay. I know in the last, let's say, few years or so, the guidelines around how frequent well child visits have changed, especially in California.
Yeah.
And I think a lot of people are, especially for the older kids, are kind of confused. But can you just kind of generally talk about, what is the frequency of the well child visits?
So early on, frequent. So we'll see the babies like soon after they're born, often usually at a 2-week visit. And then like at 2 months, 4 months, 6 months, usually 9, 12, 15, and 18 months. So every 2 months at the start, every 3 months later. After that, basically it becomes yearly. So 2, 3, and beyond, we try to do at least a yearly checkup.
Okay. Going back to the younger kids and one of the things that you were talking about is assessing their development and their milestones and how do you I guess assess that, and how do you reassure the parents that they're meeting their milestones, and are there tools that you use for that?
So yeah, I mean, there's different things that you can use. So I think each provider out there has sort of a set of questions that they grow comfortable with asking parents about. That again, look at motor milestones for them, gross motor, fine motor milestones, language milestones are some of the bigger things that we're looking at early on as well. And usually for me, that's one of the couple things that I always address with people at the end is, hey, it looks like we're meeting these milestones. Or alternatively, if we have a 2-year-old that's not speaking, at that point say, hey, this is something that I'm concerned about. Let's go ahead and do a more thorough evaluation about it. See if we can figure out, what's going on. Is it strictly just speech issues with the child? Are there other developmental issues that may be affecting it? And then the nice thing about it is once you've identified these areas where they're having difficulties with, there's therapies that we can do that can intervene and improve the outcome that they have, down the road. Maybe they're speaking more quickly, which is, makes it easier for the child to be understood by the parents, and so the child's happier, the parents are happier. But without assessing those things, you don't know if they're hitting those milestones correctly, and you can't do the interventions that you need to do to help them along.
Great. Um, and of course, because we were talking before we started here, everything is pretty much revolving around COVID right now, and I know early on it was very hard to get families to come in for anything,
Yeah.
well or sick visits. And so, what kind of things have you done in your office to kind of reassure parents that it is safe to bring the kids, especially the younger kids, in for a well visit?
We've actually, I mean, we've changed a number of things for us. So one, I'll say that everybody in our office is vaccinated, which is helpful. So there's no holdouts at all with that. We all got vaccinated in December and January once the vaccine was available. Two, we don't have a waiting room anymore. So everybody pretty much waits in their cars, or we have a grass area outside of our office where people stand outside and kids will play around there. So we don't have people grouped together in there. So basically people call, tell us that they're here. We tell them we'll call them back when we have a room available. So there's really no mixing of patients together. So people come into the room. They see the MA or the nurse who checks them in, who's also masked as well. Everybody in our office is masking. At this point, we're all in N95s, not just regular masks as well. And then they'll see the provider who's seen them, and then they leave. And we don't really even have a checkout area either, just trying to limit, things so people end up calling and setting things up, or sometimes the MA will go back in if they're doing vaccines or stuff and set stuff up there. So we're really trying to limit face-to-face interaction of people. It's really only with about 2 people in our office that they'll see between the MA and the provider, and there's no mix of patients and kids together, which I think has made things a lot safer.
Great. Yeah, I've been to a couple of doctor's appointments myself where they did the same thing, wait in your car and we'll call you when we're ready. Yeah, I think that's a pretty standard thing these days. And once again, talking about COVID, you mentioned before we started that your practice is now doing the COVID vaccination in the office. And can you talk a little bit about that and how that's gone for the kids, and what, as far as we understand, the future is coming for the younger kids as well?
So we've just started doing COVID. Practically, it's a little more difficult to get everything there just because some of the storage requirements for the vaccine, and then how quickly you're supposed to use the vaccine after the vial's been opened. So we've been trying to figure out that process. But we had a pretty large turnout for people today. We had a whole afternoon with one provider and one MA just dedicated to doing that. That's all I did this afternoon was give those out. I think we've met a lot of people who have been more comfortable doing that vaccine at the pediatrician's office than they would be at a pharmacy. And so that's sort of what they were waiting for us. So that's good. We're pretty much asking anybody 12 or over if they've been vaccinated now and offering for them to get the vaccine. So at least at the start here, we're seeing a pretty good response to that. Hopefully, we're going to see a continued response to it. And then I imagine when that age gets lowered to whatever it gets lowered to, 5, 2, stuff like that, there's going to be a huge response, for people wanting to get their kids vaccinated. I've had lots and lots of people ask us before, and obviously at those ages, we're not able to provide it, or no one's able to. So once that opens up, I imagine we're going to have a clinic full of people wanting to get them vaccinated then.
Maybe working some Saturdays.
Yeah, we may do some Saturday things, or just I don't know. Something to get things into people's arms is going to be the big thing for us. So
Definitely. Yeah. All right. That's great. You mentioned this a little bit earlier, but that's kind of the things that you talk about in a well visit. But are there things that you consistently talk about in well visits, or pieces of advice you found over the years you tend to give very frequently and at certain times?
I think there's sort of anticipatory guidance, things that we do for patients. Each of our well visits, we have some papers that go out to people. There's safety sheets, which are focused on different ages on the things that we worry about. So those we typically go over with people, especially first-time parents who haven't heard things like that. Sometimes the 5th time around, the parents aren't quite as interested to hear the same thing over again. And then there's things that talk about what do you expect, coming up over the next, couple of months between visits, just to give people ideas about what they should be looking for. There's things we talk about, food and sleep and elimination. Those are all questions that we get from parents very often. So those are pretty standard things that we talk about. And then sometimes, I guess, you get questions from people and you kind of just draw on your own experience as a parent as well. Of, hey, this is what worked for my children or me. It doesn't always work for everybody else. But sometimes personal experience can be something that's nice to share with people as well as a parent also. So.
Excellent. Yeah. I understand your comment about first-time parents. As a first-time grandfather, I get a lot of texts and calls from certain parents there, and yeah, everything they're worried about, and it's a very interesting experience.
The more experience they have, the less questions you get usually, right? So
Exactly. Yeah. All right. Any success stories in development, or just in general in in well visits where you've found something that's a problem and were able to, resolve it, something that's kind of stuck out over the years?
I can tell you something from yesterday. Is I had a mother in with her son who was diagnosed around 2 with autism. So he's on the autistic spectrum of things. He got referred to Red Coast Regional Center. He got all the interventions that went along with that, special schooling, behavioral interventions, the works of things with him. At that point, there was lots of self-injurious behavior, stuff like that going along. And now he's 8. And she was in talking with me saying, hey, the IHSS papers, the in-home health services papers are coming through there. And I really don't think we need it at all anymore. He doesn't have a 504 IP in school anymore. He doesn't do anything to harm himself. He's at the top of his class doing things like this. And she really gives much and much of the credit to all the early behavioral interventions and stuff that he had with that. That's a great example of something working in the way that you hope it would. Doesn't always go that way, but sometimes when we get the early interventions with it, you get great success stories, and that's fantastic. On top of that, sometimes you'll see some type of illnesses or things that people have, that can be long term, and obviously, figuring out that people have these going on and getting the treatment from either us or the specialists that they need and curing things, that can be something you pick up on the well visits as well. Honestly, those probably happen more with the intermediate in between sick visits where people come with, hey, I'm concerned about this and do it. But from the developmental part, I thought yesterday's visit was a perfect example of a great success story for that.
That is pretty amazing and stuff. And I think that's something to emphasize with well visits and why like we're talking about this and why we do so many early, because if we can catch some of these problems early, the therapies typically work better.
Yeah,
And I think
exactly.
that's a perfect example of that. So as part of your following development, and I know there's tests that you can do, screening tests looking for development, but there's also a kind of a newer one along that lines called ACEs, or screening for ACEs. Can you talk a little bit about that? Why we do it, or why it's important for kids, and what it kind of entails?
So ACE is adverse childhood episodes that they have with that, and what people have learned is that these type of stressful events in a child's life can affect their health in the present, both mental and physical, can affect their health in the future as adults, can increase the risk of things like diabetes, heart disease, high blood pressure, stuff like that, and even farther out has the potential to affect the health of their children as well. And so this is one of those things that people have realized plays a large part in some of the poor health of society in general. And so what we're hoping to do is to identify when these stressful events are happening, in a child's life. One, would be nice to be able to prevent them from the very beginning, too, so they don't experience them. But two, once they do, there are some strategies people can use to try to minimize the effects that those events have on the child's health now and in the future as well. Teaching issues like resiliency, making sure that they have loving, good relationships with parents, other children, stuff like that. And so we're trying to identify these children who are at risk for that, with the hope that some of the things we talk about can minimize the effects that they have on their lives.
Great. All right. So tell me a fun fact about Dr. Killfoil. Something unusual, or
Um,
something that most people don't know. So,
Most people know. I'm a huge sports fan.
okay.
I played soccer in college, so soccer is probably one of my passions things. Both my kids grew up playing soccer. I helped with some of the youth stuff with them for the last 7 years, not this year, but the last 7 years. I'd been an assistant coach at Fortuna High's girls soccer team there. So it's one of my loves. But any sport in general, but soccer in particular. And outside of that, love the outdoors, love to camp and get outside.
So you mentioned earlier that when kids come in for their checkups when they're young, there tends to be a lot of vaccines and a lot of things that we're trying to protect them against, and that gets less as they get older. Can you talk a little bit about, why there's so many vaccines for kids when they're younger, and just a general idea of what the schedule is for that?
Okay. So yeah, so there's a lot of vaccines. For the younger children, the first year and a half is where we try to get the majority of them into them. And it can seem sometimes overwhelming for parents and seem like a lot of needles going into thighs for babies. But it's important. This is an age when they're most vulnerable to a lot of these illnesses. And we want to protect them as quickly as possible against some illnesses that are really severe and some of them that are deadly potentially for them. So usually most people get offered a hepatitis B vaccine at birth. And then most people then will start the other vaccines at around 2 months of age. And so there's a number of 2 months and 4 months and 6 months. For us, how we schedule stuff in our office, usually the 9-month visit is a break from things, and then again at 12, 15, and 18 months. The reason that we want to get them again early is if these are delayed, then those children are not as likely to be protected against those illnesses. And so if they're exposed to those illnesses, they're more likely to pick them up. And if they pick them up, again, there can be potentially serious consequences from catching these things, with children getting very, very ill, or there's death sometimes from these things. So we want to get them protected as quickly as possible.
Excellent. Yeah, I think, certainly people can once again see during, the COVID pandemic how dangerous viruses can be, but I think a lot of people forget about the successes from the vaccines. Like measles. Measles is actually more contagious than COVID and more deadly,
Yeah.
but we don't see it much anymore because of the vaccines.
It's an interesting story. So our practice was founded by Dr. Mogel, John Mogel. So it was back in 1976. And when I got there, he was telling me stories when he was first a pediatrician there. This was before the Hib vaccine was out. And he said when he was there, every 2 to 4 weeks, he would have a child in the hospital with meningitis. And it was almost always Hib meningitis. And so I think it's maybe like 85, 87, the 2 Hib vaccines sort of came out at that point. Since I've been in practice, I've never seen a case of Hib meningitis. So 25 years here, never seen it. I don't think I ever saw it when I was in Philadelphia either. And that just shows how incredibly powerful these vaccines are. From someone here has seen something every 2 to 4 weeks, in our small practice, to not seeing it in 25 years, amazing what vaccines can do.
Yeah, I agree. I've never seen Hib meningitis. I've never seen epiglottitis.
Right.
When I was in residency, we used to see pneumococcal sepsis and pneumococcal meningitis. And, the last few years in practice, never saw it.
I had a kid a number of years ago unimmunized for pneumococcus, and she got pneumococcal meningitis and spent a fair amount of time down in UCSF's ICU, had some hearing loss from it as well, survived. But a good example of something that could be prevented from vaccines.
Some lessons for today.